that could have gone better, but at least I have things set up. So I'm gonna just move this as much as I can. And I'm gonna literally go out of your lab manual so you can see what's going on. So the first, your lab manual says the frontal bone. So we already know from last night, frontal bone's gonna be here, the glabella is right here. And then I said, when we start learning this, we're gonna start learning parts of the brain too. So the frontal lobe is here, right? And we talked last night about a frontal lobotomy and how it can change your personality. So this would be your, executive function, decision-making part of the brain. But for right now, learn the name of the bone, and then deep to that is going to be the portion of the brain in some cases. All right, so we have the frontal bone there, the supra-orbital foramen, or notch. So remember, supra means above. Those are the orbits. So on a skull, it's not even on this one. Okay. Anyway, last night we had the real skulls out, but maybe you can see in here. All right, 12, supraorbital notch. All right, that's in a real skull. All right, and the glabella. All right, so I can guarantee probably 90% that that's not going to be on your lab practical, because everyone keeps asking me to put that on there, so it's not going to happen. All right, parietal bone. These are posterior, lateral to the frontal bone, form the sides of the cranium. All right, so leave this portion in here. And remember, yesterday I said temporal means time. It's where men gray first. So there's going to be your temporal bone, and we talked about the squamous portion of the temporal bone and the temporal portion of the zygomatic. So I'll get into those here in just a minute. All right, sagittal suture from your lab book. Midline articulation point of the two parietal bones. All right, so there's your parietal bones here, and then sagittal suture. Now that should be easier common sense, because we already talked about the sagittal plane, right? In week 1, we talked about sagittal cut, coronal cut, transverse cut. So literally it's going in that plane. All right, so we're going to name this one. All right, so it's plane. This part back here, all right, that's going to be named lambda by its shape. Okay, and we'll see that here in just a minute. All right, coronal suture, point of articulation of the parietals with the frontal bone. And this is the coronal suture. It's a coronal plane. Remember, the coronal plane divides the body anterior to posterior, ventral to dorsal, however you want to think about it. And this is not exactly a mid-sagittal, it would be directly in the middle, but it's still a coronal plane, coronal suture. All right. Temporal bone is next in your lab book. All right. Inferior to the parietal. So there's your parietal, inferior in anatomical position. All right. The temporal can be divided into 4 major parts. There's a squamous region, right? Butts to the parietals. The tympanic region, remember I said tympanic relates to sound, or your tympanic membrane of the ear, surrounds the external ear opening. The mastoid region, all right, remember we talked about inflammation of that, right, in the area posterior to the ear. And the petrious portion forms the lateral portion of the skull. And when you open the skull up, you'll be able to see the petrious portion probably easier. Zygomatic process, all right? And I said last night, remember, we're talking about your cheekbones or whatever. That's literally your zygomatic. And a process usually means something that's jutting out. So a bridge-like projection joining the zygomatic bone and the cheekbones anteriorly. Together, these two bones form the zygomatic arch. All right. And then we spent a little time talking about, this area here. And I said if it was ever on your lab practical, we would number that. All right, but that wouldn't really be fair. All right, so we would give you definitively either one of the 2 bones and ask you what it was. All right, mandibular fossa. Remember, fossa means a depression. All right, so I don't know. So there's the mandible. So we're going to look for mandibular fossa, rounded depression on the inferior surface of the zygomatic process, anterior to the ear. I just lost my spot here. Forms a socket for the mandibular condyle, the point where the mandible lower jaw joins the cranium. All right, so remember we were talking about TMJ, and we talked about the rami being an angle, a jutting, a short projection, and I said this is a temporal mandibular joint. All right, and I said this is the coronoid, not to be confused with the coracoid process on the scapula. All right, so we'll be looking at some of these when we look at the mandible specifically. The mandibular fossa, fossa is going to be a depression or an area. So when we look at the ulnar and the radius, we're looking at the olecranon. There'll be a fossa in there. Usually a fossa is an area for something to fit into it. All right. External auditory meatus or external acoustic meatus. All right. The canal leading to the eardrum and middle ear. All right, so we can probably see that here. All right. And then when we go inside, we're going to see another area near that for the cranial nerve for sound. Right. And remember last night I mentioned that nerve is it good for sound, and I said, what other functions does the ear do? And you guys told me, they said balance. So we're going to realize that, vestibular cochlear nerve is going to be for hearing and balance. And I talked about the otolith, and if, I asked you guys if you knew where the X, Y, and Z plane was, because you have vestibular parts of your ear that are sensitive to either X, Y, or Z plane. And I said if one of those otoliths gets stuck in a position, all right, so one side of the, one ear will tell the body where it is in time and space properly. The other one's going to be stuck in a certain position, so you're getting mixed information. It can cause a lot of vertigo and a lot of things going on as far as balance and nausea. All right, styloid, all right, is a pointed projection, just like the stylus. You all are probably too young to remember what a stylus is on the old turntables, but there's a styloid process there. And I said to you guys last night, it's going to be the attachment site for muscles. It's going to be an attachment site for some of the neck muscles. So when you're looking at that, just go in and ask Siri or OK Google and find out what attaches to that. It's going to give you something to attach that information to. We talked last night about scaffolding, so start using that. Like I said, if you can attach the information to something, it's going to give you a basis for remembering it. Okay? So styloid process is a needle-like projection inferior and external to the acoustic meatus, right here. Right? Attachment point for muscles and ligaments of the neck. This process is often broken off. So a lot of times they'll get broken off from just people snapping it off. And on the real skulls we looked at last night, 2 of them were missing, all right? And that wasn't from abuse. They just they just broke off. All right, mastoid process is down here. Hoping this is in focus, everyone. All right, rough projection. All right, so think about this. If it's a rough projection, remember we talked about the periosteum and how tendons attach to that. So muscles attached to tendons attached to the periosteum through those Sharpie's fibers. So it's going to be an attachment site for that. Right? Right. Rough projection inferior and posterior to the external auditory meatus. Right. Attachment site for muscles. The mastoid process is full of air cavities. Right. It's very close to the middle ear. And we said last night, if we get an infection in the middle ear or there, it can transmit into those areas very quickly. Because when we looked at the real skulls last night, we saw how airy those were and how things could easily transmit. And we talked last night about the cerebral spinal fluid and how we really don't want anything entering that area. We don't want any kind of infection in there because it's very, very hard or impossible for your white blood cells to get in there. So the only caveat you have are really those glial cells, the supporting cells of the neurons to help with that. All right. Often becomes infected to a tissue referred to as mastoiditis. All right, I said, and don't confuse that with mastitis, all right, which is common in cows, if they don't drop their milk completely, if they don't drain, if they're not milked completely, they can get an infection. That's mastitis. This is mastoid, and itis always means inflammation. Okay. All right. Stylomastoid foramen. So foramen, once again, is a hole. So tiny opening between the mastoid and the stylus, process through which cranial nerve 7 leaves the cranium. So I don't know if it's going to be invisible in here. All right, so right in there, it's very, very tiny. So remember, I said you can learn the holes, or you might as well learn what goes through them for a reason. All right, so while I have a second, I'm going to bring this one up here and maybe you can, good grief. All right, look in here. So I just opened this up. So these are your cranial nerves, and remember I said last night, they're numbered from 1 through 12, and they're by location from superior to inferior. All right, there's cranial nerve 1, olfactory, and if you look, if I can do that, it's literally up here. All right, so for the nose, it's gonna, there's your vomer, it's gonna be there for sense, right? And cranial nerve 2, right here, literally lines up with the eyes, all right? And then as you go down here, they're numbered, all right? There's trigeminal, has 3 branches. Right. And then just like I said, we're going to name them as you go down. So here's what they look like. They're not in the skulls that we did last night, but this is showing you the circle of Willis here. So in case you have an occlusion, the blood can recirculate, or kind of a backup system. And we'll look at the basilar artery. And we talked yesterday about the vertebral arteries in here. And I told you guys if your neck is out of alignment, it can impinge that, and then you don't get blood supply really to the muscles of your head. Right? And we're going to be learning the muscles of the skull. And when they don't get muscles, they cramp up, and that can really be a common cause for a lot of headaches, and specifically what people would term a migraine sometimes. All right, jugular foramen. All right, so we've all heard of our jugular. We've all heard of our jugular vein. All right, opening medial to the styloid process. All right, styloid process, it's going to be medial. Right. So it's the internal jugular vein, and cranial nerves 9, 10, and 11 pass. All right, so we're going to find that. All right, so it might be easier if we grab the other model here. So jugular foramen, you can see that, all right, yep. So you can see it on this model, and then over here, you can see where all those cranial nerves are coming out. Okay. See the jugular foramen, all right, the occipital bone, occipital here. And remember last night I told you that cranial nerve 2, all right, part of these fibers cross over. Remember, the sella turcica is right here. That's where the anterior pituitary gland sits. So sometimes if you have a tumor in here, it can start occluding that. And I said you're going to start losing some of your peripheral vision. All right, but the image is going to go all the way back around here. All right, it stops. There's some areas in the medulla where it stops. All right, but we'll talk about that when we get to the special senses. But they're going to innervate back here. All right, the occipital lobe of the brain. It's back here, and I talked about last night. Have any of you fallen like in the ice and you bang your head? And I said, did you see something visual? Because you're going to traumatize. You're going to send trauma to the area of the brain. It thinks there's an image coming through, because you're going to irritate that portion of the brain. All right, lambdoidal suture, site of articulation of the occipital bone and the parietal bones. All right, parietal and occipital, so lambdoida or lambdoidal. All right, foramen magnum, remember that means big hole. All right, large opening in the base of the occipital bone, which allows for the spinal cord to come through. So your spinal cord literally is going to come through here, right, foramen magnum. Look at how big that is. And remember, I showed you the spinal cord last night, and I said, well, why is this opening so big? Remember that every single afferent, efferent nerve, all the way from your head all the way to your toes, has to run up that racetrack. That's why it's so large. Everything runs through there. Right? That's why if you have an issue upper cervical, it can cause paralysis all the way down. So I'm wondering if maybe not. So there's for foramen magnum from superior to inferior. This is where your spinal cord would come up. Right. Sorry about, there's another anatomy class going on right now. So some of the models are gone, so I couldn't get them all. I'm going to pop this off. And we'll see here. There's your brainstem coming through. This is where the foramen magnum is. All right. There's your cerebellum. All right. The cortex here. And then this would be the frontal area. This will be the parietal area. This will be the temporal area, deep to those bones we were talking about. Okay. So I don't know if this is helping or confusing everyone. But all right, occipital condyles. Remember I said a condyle is usually a rounded area. And I talked to you guys about, and I said, you guys know who Atlas is? And someone said, yeah, he's the guy who held up the world. Well, the occipital condyles are here, right? They're going to sit on the axis, which is cervical, the first cervical vertebrae. And I said, well, what does that motion, it's like a spoon on an egg. I said, what motion does that allow? And I said, yes, Dr. Phil, yes, Dr. Phil. So it allows that flexion and extension as it rocks on that occipital condyle. Maybe I can find it. Yeah, maybe. Sorry, this is a little awkward. All right. So, yeah, there's C1. All right. There's C2 when we talked about the dens last night. And there's a ligament that goes through here. And C2 allows for that rotation this way. All right. C1. Sorry, I wish I had a better, different model, but it's going to be the occipital condyle is going to sit on C1. All right. First cervical vertebrae. All right. Hypoglossal canal. And I said, what is hypo means under? And I said glossal usually refers to tongue. All right. Hypoglossal canal, opening medial and superior to the occipital condyle, through which the hypoglossal nerve, cranial nerve 12, passes. We talked last night about, having your patient stick their tongue out if you're doing an exam and see if they have trouble doing that. If it deviates left or right, it can indicate what part of the brain might be damaged. Right. Okay, let me just flip the page here. Try not to make all that noise. Okay, so the next portion in your lab book is the sphenoid bone. Remember, that's that butterfly shape bone forming the anterior plateau of the middle cranial fossa across the width of the skull. All right, so let's see if I can get this in here. All right. So the sphenoid, when you look at it, it's going to be, in here it's in yellow, all right? Sort of, you can see it's a butterfly shape, all right? And if you remember specifically, unless I'm losing my mind, all right, it literally should be touching just about every bone in the body. It articulates. Remember that word we talked about last night? Articulates. Right. Okay. All right, so we're looking at the greater wings. All right, they make part of the orbit. As you can see in here, there's the orbit. The greater wings here, if you turn this around, make part of the orbit. And remember, once again, I'm going to mention it again and again and again. There's the sella turcica, all right? There's the crystal galli. All right, remember, this is the attachment site for the dura mater. And we talked about similarly how your heart pericardium is attached to your diaphragm. This is going to attach to the dura mater. That's called tough mater, or that lining surrounding your brain, holding in the cerebrospinal fluid, making sure that there's nothing can get in there. We don't want any kind of infection, infection of the meninges or meningitis can be lethal very, very quickly. Superior orbital fissure, so just go by the name, super or superior orbital fissure, jagged openings in the orbits providing passage for cranial nerves 3, 4, and 5. So supraorbital fissure is going to be a larger opening, right? So I said 1 was olfactory for smell. It's related to taste too. 2 is going to be your optic nerve coming right off your retina. All right. So then 3, 4, and 5, I said, and 6 are going to be involved in the lateral rectus, medial rectus, a lot of those eye muscles. So that makes sense. They're coming off the brainstem, 3, 4, and 5. So as I stick this swab through here. All right. I'm going to grab this one. Sorry, everyone. So there's cranial nerve 1, olfactory. All right. There's 2. All right. And then literally, your eye muscles are coming right through the supraorbital fissure, coming right through there. This is going to innervate those eye muscles. Okay. All right. So if you want, what you're doing is just kind of look up cranial nerve 3, 4, 5, and 6. We're going to be innervating the trochlear, and they're going to be innervating medial rectus, lateral rectus part of the eye, causing you to move your eye left or right, or rotate it, or focus on things up close and far away. All right, so just look at them. You don't have to memorize them now, but at least you'll have heard them before. It won't be as difficult later. And once again, remember, cranial nerves are numbered 1 through 12 from superior to inferior. Most of them stay at the cranial nerves. They stay in the cranium. The larger numbers towards the bottom, they tend to leave. All right, and they're going to be innervating the accessory muscles of the neck. And remember, 10, vagus is a wandering nerve. It goes all the way into your viscera, helps regulate part of your parasympathetic nervous system. And once again, I don't know if it's in your book or not, but it's sending information from your microbiome back to your brain. So the gut-brain axis, they can communicate with each other. All right, so the next portion is the sella turcica, or Turkish saddle. It's a saddle-shaped region and the sphenoid midline. All right, so there's that sphenoid bone again, greater, lesser, all right, making up part of the orbit. There's a sella turcica right in here. All right, encloses the pituitary gland. The pituitary gland sits in the hypophyseal fossa portion of the sella turcica. Right. And yeah. So that's all. That's good enough for now. Just realize that that's in there. When we start looking at the brain, when we dissect the brain, we're going to see where that would actually sit. Right. And it is right there, literally. Right. And it's hard to see here. Right. But there's your sphenoid bone, there's the sella turcica, and this guy literally sits right in there. And there's your olfactory or optic nerve. Right. Like I said, these are numbered all the way down, 1 through 12, and they're going from superior to inferior. All right, lesser wing, all right. the bat-shaped portion of the thenoid bone anterior, all right, to the sella turcica. Right, it's right in there. All right, foramen rotundum, so that always means round. Opening posterior to the sella turcica that allows passage of the branch of the fifth cranial nerve. All right, so it's going to be back in here. It's going to be more posterior. So, 1, 2, 3, 4, 5 are going to be in through there, and then the fifth cranial nerve is going to go through there. Cranial nerve 5. Right. Remember last night I said, well, I couldn't remember what cranial nerve 5 was. I may looked it up. So sometimes you'll just forget, and you'll have to remind yourself. Right. Foramen ovale, opening posterior to the sella turcica that allows passage of the fifth cranial nerve also. All right. So ethmoid bone is a regularly shaped bone anterior to the sphenoid. Forms the roof of the nasal cavity, upper nasal septum part of the medial lateral orbits. All right. Ethmoid. All right. So last night someone asked me where the vomer was and ethmoid. So they're all in through here. So you just have to figure out whether they're going to be medial or lateral and what they form. And if you look in here really close, you're going to see that the orbit is made up of many, many different bones. Okay. And then last night we talked about someone's temple is here. So this can get crushed very easily. You can see how fragile that might be. So a blow to the temple can be very, very devastating. So temple, cheekbone, that area can be very, very devastating. All right. Cristogale is here. All right. Remember we talked a little bit about that, and I said specifically it's the, you can see it maybe a little bit more in here, the attachment site of the dura mater, right, tethering that down. Right. Yeah, visceral projection providing a point of attachment for the dura mater, helping to secure the brain within the skull. You want it anchored. All right. Cribriform plate. It's a bony plate lateral to the cristogale through which the olfactory nerves pass. Right. They pass through here. Right. And these really are, there's some debate on whether they're actual nerves or just nerve endings. Right. The olfactory nerves pass through to the cribriform plate, and the midline cristogale form the horizontal plate of the ethmoid bone. All right, and cranial nerve 1 for olfactory. Interesting fact, if you care, if you've all heard of Lysol, and you know how Lysol is supposed to get rid of odors. Well, literally, what usually happens is it actually can kill off cranial nerve 1, so you don't smell anything. Cranial nerve 1 will grow back. All right, so I said in class that a lot of the nervous system doesn't grow back. Cranial nerves usually don't, but that portion of the cranial nerve 1 are just sort of like dendritic cells that they can regenerate if they need to. All right. Superior and middle nasal conchae. Remember we talked about nasal conchae, and I said it causes, you can see that, I'm going to pick his nose, but you can see that in here. All right, and I said that causes turbine. It turbinates the air. We want that air to be moist. And we talked about all of that area having mucous membranes, and mucous membranes are what is in contact with the external environment. And all mucous membranes have goblet cells, which produce mucin. Mucin, when it comes in contact with water, produces mucus made out of the goblet cells. And remember, I said that the mucous membranes should all secrete IgA, immunoglobulin A. It is an antibody, all right? So it should help bind to certain antigens and alert your immune system that something foreign may be coming in, because once again, these are all exposed to the external environment. And I talked about we want to moisten and warm that air, and it is October, mid-October now. And I said to all of you, have you been in Buffalo in February? And you all said, well, of course. And I said, well, imagine if you took a great big deep breath of our Buffalo air in February and you didn't warm it up, and it went into your respiratory tract and it got your alveoli. It would freeze those squamous cells, and the diffusing membrane would be destroyed. So we really want to warm that air as it goes deep into the respiratory system. When it gets to the terminal end of the alveolar, we don't want it freezing that tissue. All right. So I'm gonna end it here, and I'll pick this up later. So we got through 79, 80, most of 81. I will pick this up with the facial bones. I'm already like 30 minutes in, so I'm gonna stop it here.